Can you share food with someone who has hepatitis? The question of whether you can share food with someone who has hepatitis is an important one. It really depends on the type of hepatitis involved and how the virus spreads. Let's break it down. Hepatitis A is a highly contagious liver infection caused by the hepatitis A virus. This virus spreads mainly through the fecal-oral route. This means that if someone with hepatitis A does not wash their hands properly after using the bathroom, they can contaminate food or water. If you share food or utensils with someone who has hepatitis A, there is a risk of transmission if hygiene practices are not followed. For example, if an infected person prepares food without washing their hands, the virus can easily get into the food. The virus can also contaminate food during growing, harvesting, processing, or handling. Therefore, sharing food or utensils that have been contaminated can lead to transmission. However, if you are sharing food with someone who has hepatitis A and both of you are practicing good hygiene, the risk is generally low. To prevent the spread of hepatitis A, it is essential to practice thorough hand washing with soap and warm water, especially after using the bathroom and before handling food. Regularly cleaning and sanitizing surfaces and utensils is also crucial. If someone is ill with hepatitis A, they should avoid preparing or sharing food until they have been symptom-free for at least 2 days. Now, when it comes to hepatitis B and C, the situation is different. These viruses are primarily transmitted through blood and certain body fluids, not through casual food sharing. So, sharing food with someone who has hepatitis B or C does not pose a risk of transmission. In summary, sharing food with someone who has hepatitis can be safe if proper hygiene and food safety practices are followed. For hepatitis A, extra caution is necessary to avoid fecal-oral transmission by ensuring good hand hygiene and avoiding sharing contaminated utensils or food. Vaccination against hepatitis A is also a highly effective way to reduce the risk of infection. By maintaining these safe practices, you can help protect liver health and prevent hepatitis infections that could lead to liver inflammation and potentially liver cancer over time. Always remember, if you have concerns about hepatitis or liver health, consulting a healthcare professional is the best course of action.